Because you see, when you enter the doctor's room, the doctor is just ready to listen. The doctor is warm. The doctor is kind.
We have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
And I would wish young people could come here too, so that they could feel how I felt. That's why I keep coming to Mata over and over and over. Their services, top notch.
Mata Misericordia Hospital.
A very warm good morning wherever you are, and you are right on time for this special segment, Health Discourse, this 26th day of Monday, and we are coming to you live from the Cardinal OTUNGA PLAZA, courtesy of the CARITAS Microfinance Bank. But this is the Health Discourse right here on Capuchin TV, of course brought to you by Capuchin TV in partnership with Mata Misericordia Hospital. And I'm your host, Sasha Elizabeth, and today we are handling a critical health issues affecting millions globally. This is hypertension. And did you know that according to the World Health Organization, over 1.2 billion people worldwide grapple with high blood pressure, with nearly half of them unaware of this condition. And even more alarming is that hypertension is responsible for an estimated 7.1 million deaths annually, which equates to about 12.8% of all deaths worldwide. And in Kenya, recent statistics reveal that approximately 1 in 4 adults is living with hypertension, making it a silent yet deadly epidemic. So what can we do to protect ourselves and our loved ones from this silent killer? Joining me today for this discourse is none other than Dr. Akunga Oli from Mata Misericordia Hospital, who is a physician as well as a trainer. Good morning, Dr. Akunga. Thank you very much for making time for this conversation.
Thank you.
What do you do in your department as a medical physician as well as a trainer at Mata Hospital?
Thank you very much, first of all, for having me here on behalf of Mata Hospital. So I'm a consultant physician in internal medicine and also a clinical researcher in charge of our internal medicine department. In Mata, we also have postgraduate training within the internal medicine department, which basically means that we've taken on board medical officers who are interested in becoming specialists in the area of internal medicine, of which hypertension is one of the biggest diseases under internal medicine. So the college that we've partnered with is the East, Central and Southern Africa College of Physicians. It's an Africa-wide program. Based in 6 countries. Kenya is the youngest, and Mata Hospital, we pride ourselves as the first hospital actually that started this collegiate training for the specialists. So by and large, other than the regular clinical activities within the department, we heavily support the training program as well. Yes.
Brett, we are glad to have you today. And as I said, my name is Sasha Elizabeth. We really value your feedback. If you would like to weigh in on the conversation, feel free to do so. You can drop your comments and questions pertaining hypertension on our social media platforms, that is Facebook and YouTube, or just direct your questions on to our number 0717-424-866. You can also use our SMS line, which is 21760. So off we start with the conversation with the most basic questions, and that is hypertension is often called as a silent killer. Could you tell us, Dr. Akunga, what exactly triggers high blood pressure?
So, very good point that you've brought up, a silent killer indeed. Why, let me start by explaining why we call it a silent killer, is because typically speaking, there are no symptoms. Some people will tell you when your pressure is high, you'll have a headache or you'll have blurry vision. That is when it's gone too high to a point of affecting vital organs in your body. But essentially, it's a silent killer because it has no symptoms. The only way of knowing whether or not your blood pressure is high is by having it checked. And I'm sure many of the viewers have been to a clinic, and the first thing we do when you meet the nurse before seeing the doctor is your pressure is taken. And that's the only sure way of knowing whether your blood pressure is high. So where does it come from? Now, clinically, we classify hypertension in two broad categories, either primary or secondary. When we say you have primary hypertension, it means we don't know what is causing it. What would classify as hypertension that has come about due to a problem that we may not be able to solidly identify. So your pressure has gone high, and now we need to focus on the treatment. Of course, there are other tests that we do beforehand to determine whether or not there is a causative issue that we can handle. When we say it is secondary, it means there is a problem in your body, one of the organs. Sometimes it's your thyroid that's a problem. Sometimes it's your kidneys. Sometimes it could be anything. Even in the recent past, we all remember the time when we had the COVID-19 pandemic, we saw a lot of new cases of hypertension, basically because of how that acute illness was affecting the blood vessels. So when you have the hypertension due to another cause, of which when we treat that cause, we are able to sort of reverse your hypertension, then we call it secondary hypertension. So those are the two broad categories you can say as far as where we think that hypertension issue comes from.
So that explains why every patient, whenever they visit a medical facility, they have to go through the triage for them to get their pressure tested and other preamble tests.
Precisely.
Oh, okay.
Because it's one of those key indicators of health in the human body.
So what numbers are we talking about, looking at what is considered a normal a normal range of healthy blood pressure?
So if you've been keen whenever we are doing this test in the hospital, you'll notice that we put two numbers, one upper figure and another lower figure, X over Y. So as per the worldwide guidelines, of which we have various bodies, various authorities in the world that all clinicians subscribe to, because I cannot sit as Olive and say, okay, if your cutoff is above this, then you're hypertensive. No, we have to go by the world standard. So 140 over 90 millimeters of mercury, those are the units we use. That qualifies you as a hypertensive. But that said, we have categories of normal, of which it goes up to 129 over 79. Once it hits 130 over 80, 81, we start saying you are in the pre-hypertensive phase. So anyone between 130 to 139, systolic, of which that's the X figure, the upper figure. If it is between 130 and 139, you need to start living as if you have hypertension, because you have a chance to reverse it. We classify you as pre-hypertensive. You're not within the normal range. When the lower figure is between 80 to 89, again, we say you are pre-hypertensive. You need to start employing certain lifestyle changes that will enable you to reverse back to the normal. Yes, for a normal healthy adult, around 120 over 80, based on, again, a myriad of factors, but thereabouts is classified as normal.
In terms of the at-risk groups, how would you range the young populations and the older ones, including children, who are more at risk of being hypertensive?
Very interesting question. That has changed in the recent past. Before, we used to say people above the age of 40, 45 should be screened for these diseases because they are more at risk. That has changed. I'll tell you, for example, in my clinic, I have very many clients under the age of 40. Most of my patients range between 35 to 39 with hypertension, newly diagnosed, diabetes. So there's been a paradigm shift in terms of the chronic illness epidemiology. And when we say epidemiology in medicine, that's basically the disease profile, including age. So we've seen that really change over the recent past, of course influenced by very many things, including lifestyle, use of various substances, the food that we consume, obesity that has now become a pandemic the world over, including in Africa. Various things that are now contributing to this, what we call lifestyle illnesses, being seen earlier than they were before. So similar to hypertension, the screening age has now come down to the 30s. And by screening, I mean when you need to start paying attention to your body in terms of checking your blood pressure as regularly as you can. We're in an era where these machines are now easily available in pharmacies. So you can even purchase one and keep it in your house and check yourself, every so often. So that has shifted, and it's now in the much younger population, the 30s.
So we could all be walking around with hypertension,
Absolutely.
but unaware.
Absolutely.
Okay. Now, high blood pressure doesn't just affect the heart. Could you share with us the range of some of the health problems that are linked to this silent killer?
So for hypertension, in fact, broadly what we try to avoid by treating is the complications, as you've mentioned. And these complications, again, the categories are, in terms of small vessels that are affected. Remember, hypertension means a tense blood vessel, a vessel under tension, if you were to define that word further. So these vessels can be the large vessels in your body, or they can be the tiny, tiny vessels in your body. So large in medicine, we call that macro, so macrovascular complications, and the small ones micro, small. So for the small blood vessels, you can have the eyes being affected, the small vessels that, form a part of the filtration system in your kidneys can be affected, and you have very many patients ending up on dialysis because of this. Large vessel involvement, anything from, large vessel strokes in the brain. You can have cardiac arrest or other heart diseases due to this. So you can literally have any organ being affected as a result of this. Sometimes because of the small blood vessels that supply the nerves in the body, you end up with people with what we call neuropathy. So, pain due to nerves being affected, among other complications. But the largest, we talk about strokes, we talk about heart attacks, and kidney failure. Those are the three commonest.
Thank you, Dr. Kunga. Now, you mentioned earlier on something to do with obesity and, of course, lifestyle. Could you shed more light on the link between hypertension and obesity, and the alcohol and substance use vis-a-vis hypertension rate increase among the young people?
So for obesity, now we are having a big worldwide focus in terms of the obesity pandemic. Previously, it was seen as an issue of the West, and like I mentioned earlier, it's now in Africa, it's now in Kenya, here with us. And we have clear guidelines now, thankfully, on how to approach it. Before, we would give each other advice by the roadside, or maybe do this exercise, change what you're eating. But now we have guidelines, including all the way to surgery, to be able to control this. Now, for hypertension specifically, why obesity is being viewed as a chronic issue is because it puts you in a chronic inflammatory state. Medically, what that then means is that various organs are under that chronic inflammatory sort of environment. What does that mean? It's that your blood vessels start losing their integrity in terms of how, are they normal? For example, if this is the width of your blood vessel, is it remaining like this? Is it constricting because of certain things? Obesity in itself also being, associated with things like atherosclerosis, because obesity is as a result of diet, largely. Of course, we do have a genetic component to it, but by and large, the genetics have to interact with environmental factors, of which diet and nutrition is a big part of our environment as humans, to be able to cause that. So you find that diet, when it's heavy in fat, heavy in sugar, heavy in processed foods, then it does lead to that atherosclerosis. So again, you find that overlap. Is that to say everybody with obesity will have hypertension? No. But are they more at risk? Yes. And not just of hypertension, of many other things, including diabetes, cancers, and so on. Yeah. So that would be the association between obesity and the hypertension. The other thing you've mentioned is
on alcohol and substance
the alcohol and substance use. Again, similarly, all these things affect hormones in your body that can contribute to this issue of hypertension. For example, the alcohol one tends to be a bit more complex, and that's why we classify alcohol use as one of the listed mental health disorders because of how it alters your hormonal feedback in the brain. When you're an alcohol addict, there are certain things that happen in your neurohormonal system that make these vital signs, including your blood pressure, your heart rate, your respiratory rate, change in anticipating your next glass of alcohol, your next bottle of alcohol. And the natural thing is that sometimes it spikes because alcohol is a suppressant. It mellows down the body. Now, if it mellows you from a point of low, it will kill you. And that's how eventually sometimes we end up with alcohol-related deaths. So for alcohol addicts, when you have gotten to a point where you have affected that neurohormonal feedback, you find that sometimes your body lowers all your vital signs in anticipation, increases those vital signs in anticipation of the alcohol coming to lower it. And when it's in a sustained process of it elevating itself over time, it will stay up. And you end up as a hypertensive patient. Yes. Similar to, I think, what you had mentioned relating stress, very similar mechanism. When you are in a state of mental stress, your body releases stress hormones, including adrenaline and so on. Adrenaline, how it works in the body is by pressing on your vessels, putting them under tension, of which it is hypertension. So because you're often stressed, ideally that is normally a reflex mechanism by your body, which is protective. Okay, we call it the sympathetic activation. But over time, when your body is so stressed and it is used to producing those hormones and constantly pressing on your vessels, over time your vessels will remain in that state. And that is how you will end up with stress-associated hypertension.
Great. And in a modern world where so many people walk around with the stress, and nobody is quite immune to stress, and with the paradigm shift, as Dr. Kunga mentions, even the young populations, and unfortunately this is leading to a very sad trend of young people hitting the rock bottom and deciding to, give up on life, or self-harm and all that, which is quite a sad state of affair. But under the modalities, you're going to see how best to manage the situation. We understand that many people walk around unaware that they are hypertensive. So what is the only way and the sure way of knowing that one is has high blood pressure?
Get it checked. Walk into any facility, get your wellness check done. There's been a lot of push towards that. Even at Mater Hospital, we have fantastic wellness packages. Get your blood pressure checked. If you cannot get to a facility, get to the nearest chemist, the nearest healthcare provider, or even buy your own machine. Get it checked. If it is above 140/90, you are in the hypertensive state. Get it addressed. Yes. So
now, once you have been diagnosed with a high blood pressure, what are the available treatment modalities, especially to manage, if not cure the condition?
So first of all, I want to start by saying that once you hit 140/90, as we've said, we do not put you on medication unless it is a clearly explained secondary hypertension, as we said. You have a thyroid issue, I'm going to treat your thyroid and you'll get better. Most of the hypertension issues are primary. We may not associate them with anything. So when you start on treatment, please start it with a mentality that you may never get off those medications. And why we encourage the patients and our hypertensive clients to be positive about this is that by taking that one pill a day, you're preventing such severe complications that may disable you. Imagine getting a stroke at in your 30s. That means a whole life either on wheelchair or bedridden, but just by taking a pill a day, you're able to prevent that from happening. So that's why I wanted to, most people think, oh, it is like malaria, I'll take this for some time and I will cure it. We want to debunk that myth, that it is not an acute illness. It is one of what we classify as chronic illnesses, and you need to stay on course with your treatment, unless for another very clear scientific reason you come to hospital and we say you have to stop. Now, that said, being a lifestyle illness, the approach is very holistic in terms of diet. What are you eating? If you're on treatment but you're still not eating right, and usually you may have heard of the DASH diet, that is basically what we counsel our patients on in terms of low salt diet, low fat diet, low sugar, reduced processed foods. And if you hear that, that basically means in terms of eating healthy to prevent other things that will worsen your hypertension. Of course, you know, this may be related with issues of blood cholesterol and so on. So number one, diet. And whenever you see a physician to treat you for hypertension, most of the time we will send you to the nutritionist to discuss your dietary options. Number two, of course, an active lifestyle. One of the things we see nowadays is a lot of inactivity. With all the connectivity that society affords us, you can send, you know, you don't never have to move around much nowadays. You know, sometimes you send a rider here, you do this, you do that. Sometimes people don't move at all. So inactivity is another big contributor. Of course, sedentary lifestyle leading to obesity and other issues. So we encourage that you be active as possible. I'm focusing on that because sometimes clients think you have to go to the gym in order for you to say that you're exercising. No. Any activity that sustains your heart rate above 100 for at least a period of 15 to 30 minutes a day is good enough. If you can walk up and down the steps, if you can move up and down the water dispenser in your office, if you can walk home instead of, you know, driving or taking a vehicle towards your area of residence, anything that will sustain your heart rate to be slightly above normal for 15 to 30 minutes, that's good enough. 3 to 5 times a week, that's adequate. If you're privileged and you're able to be in the gym, again, that's good enough. What we now are emphasizing on, because we've seen a lot of patients now collapsing in gyms, and we are called severally to be able to address these issues, to an extent that I've even seen some gyms now have health forms just to protect themselves legally, because people are doing these things blindly. You're hypertensive, you're going to run on the treadmill, it can end up killing you. So you need to understand what is the context of my chronic disease, how can I safely, you know, nurture myself to health. So if you're going to be involved in exercises again, make sure it's under a trained physical therapist or physical trainer, that they understand you're hypertensive, and even in terms of what they'll advise you to do, it's well calculated. So we focus more on aerobics, but instead of running, we emphasize on walking. It's just as good. It's even better for your joints.
Absolutely.
Strength training, very good for hypertensives as well.
Thank you very much. We'll explore more antidotes and options, and of course we will be taking more questions and feedback from you, but this is not this will come after the break, so we take a brief breather, but we'll be right back shortly with more on hypertension. Stay tuned.
My name is Jemima Kaigongi. I'm expecting my first baby. The Mater Hospital is my hospital. It's where I normally attend my clinics. They have very nice, good services, and they look deep in your well-being.
At Mater Hospital, we have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
The journey with the gynecologist has been very good. And with Mater Hospital, there is nothing to be afraid of, especially when you are expectant.
Visit our website or any of our medical centers across the country. Mater Misericordia Hospital. You matter to us.
Hoy la política no tiene buena fama. Corrupción, escándalos, alejada del día a día de las personas. Pero ¿podemos avanzar hacia la fraternidad universal sin una buena política? No. Como dijo Pablo VI, la política es una de las formas más altas de la caridad, porque busca el bien común. Hablo de la política con mayúscula, no la politiquería. Hablo de la política que escucha la realidad, que está al servicio de los pobres, no de la que está encerrada en grandes edificios con largos pasillos. Hablo de la política que se preocupa de los desempleados y sabe muy bien lo triste que puede ser un domingo cuando el lunes es un día más sin poder ir a trabajar. Si la vemos así, la política es mucho más noble de lo que aparenta. Agradezcamos a los muchos políticos que desempeñan su tarea con voluntad de servicio, no de poder, todos sus esfuerzos por el bien común. Oremos para que los líderes políticos estén al servicio de su pueblo, trabajando por el desarrollo humano integral, trabajando por el bien común, atendiendo a los que han perdido su empleo y dando prioridad a los más pobres.
My name's Edwin Mugai Wamae. I'm a constant attender of Mater Misericordia for the last 30 years or so. Reasons being costs, vis-a-vis the services and the personnel. I find it very competitive, and also the doctors who attend to me are knowledgeable in so many problems that I suffer from.
We have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
Very beautiful amber parking. I do not think we have many hospitals to compare with their services in this country. Mater is the best place to go.
Mater Misericordia Hospital. You matter. To us.
You're still keeping tabs with us here on Health Discourse, the subject being hypertension. And if you are just joining us, we are discussing this silent killer affecting millions worldwide. And with me here for the second session, we continue the conversation with Dr. Olive Otunga, a seasoned physician and a consultant, of course, medical specialist at Mater Misericordia Hospital. And just to remind you, there are a few questions that we will be responding to in the course of this second session of our discourse, and we welcome you to share your questions, and we'll get Dr. Otunga to respond to them as and when time allows. Welcome back to our second session, and it seems there are so many available, quite a number of available options, but they really need a keen eye and, of course, an expert to work with someone. But there are people in this era of, self-diagnosis. Somebody walks in, they just get into their Google, and try to type if maybe I can get an antidote and walk to the next, maybe a gymnastic or the next pharmacy and try to find a solution without necessarily consulting the expert. What is the implication of this kind of lifestyle of options available?
Very good question, because It is true. We see a lot of self-medication, and by the time people are coming in, sometimes it's in very severe complications, like a stroke, a heart attack, or a client in a coma. You know, even as bad as fatalities, because sometimes when you have a major stroke or a major heart attack, you may not make it to the hospital. Now, it is important to have yourself reviewed in a medical facility and started on what we call guideline-directed therapy. There is no one-size-fits-all when it comes to hypertension medicine. What may work for you is not what may work for your brother or for your friend. We have to carry out certain tests that will guide us on which combination of medication is best for a patient. And that is why we have a lot of emphasis on the fact that treatment should be started within a healthcare facility by a well-trained healthcare practitioner. Because also we know that out there, and unfortunately, sometimes you may end up meeting somebody who may not put you on the right medication. So be very clear if you're dealing with a chronic illness, not just hypertension, on who you're seeking that advice from, and be very open to getting a second opinion. You've talked about patients Googling these things. I think it's fantastic. By the time you're going to see your doctor, it's good to be empowered from, you know, technology on what could be happening. Ask the right questions. After it's been prescribed, check on Google what those side effects are. We are in an era of information. And by all means, patients should empower themselves with this, but also discuss with your physician so that it is guided. There are many treatment options, as you've mentioned, ranging from the oral medication. We've already talked about the lifestyle modifications that patients need to employ. And now, because of research and development and various clinical studies, that can go all the way up to certain interventional things, including certain invasive things like blocking your renal arteries and so on, if we think the problem is coming from the kidneys. Not blocking them, but dealing with them. It's a very detailed intervention, but those are available in the country now. So things that people essentially used to travel to the US, to India for, we are able to offer them in Kenya right now. Yes.
On the same strain of self-diagnosis and preventive measures, we have probably the people who prefer not to visit a specialist, especially a nutritionist, to let me say, recommend the best dietary practices, and they opt, okay, let me go to Google or do any other, explore alternative options to see how I can live a healthy life. Can this be effective in managing and preventive hypertension?
Yes, nutrition is a very big part of the treatment of hypertension, and it is good to get that advice also from a trained nutritionist, but in combination. Once we diagnose you as hypertensive, nutrition on its own may not be able to deal with your hypertension. It needs to be done alongside the other, what we call conventional or, pharmacological treatment. So alongside taking your pills, alongside taking anything else that's been advised by your doctor, the nutrition bit is also very central to that management of hypertension. So that is part and parcel of the treatment. And we talked about low salt, or if you can avoid it altogether, we say you cook with very little, don't add any on the table. Low fat diet, and even in low fat, what kind of fat are you using? We've done very well as a country in terms of the packaging of oils. Now you see they've written even up to how many kilocalories are on that bottle, things that I'm not so sure Kenyans look for, but it is a habit we need to start developing and training our children as they grow to be looking at whatever they are buying, the packet. What does it say? How many kilocalories? How much fat is in this thing? How much fat is saturated versus unsaturated, and so on. So even in terms of little fat, which kind of fat are you using? Is it healthy? Is it not healthy? Sugars. Sugar is not good for anybody, not just diabetics and hypertensives. Any of us, sugar is very harmful to the body. It can do a lot of things. So if you're able to stop it, well and good. If you're able to take healthier alternatives to sugar, well and good. If you can't, then just reduce the amount, and you see major effects on your health overall. And as I'm talking to you, I'm also talking to myself, because even as doctors, we do end up as patients sometimes.
Yeah, sure.
Yeah.
Great. So you're human, and health, you're also predisposed to health issues and complications. And there's a question that is always asked whenever we bring a health conversation or topic to discuss, is that is this curable? Because it gives hope to the person that once I'm diagnosed with hypertension or any other medical condition, do I stand a chance to live again a normal and healthy life? So in the case of hypertension, what would you say?
Complex question. Is it curable? If it is secondary, which we said is because of another cause that we can identify, and by dealing with that cause, for example, you have a hyperactive thyroid, we remove it surgically or using medication, and it goes away. Your hypertension that was caused by that issue can reverse. But majority of the hypertensive cases are primary. We may not be able to identify the cause. Those are not curable. What we do is manage them to an extent that with the treatment in place, your quality of life is well sustained. And that is usually the goal of treatment. And that's why earlier I had mentioned that when we start you on treatment, it's good to have that understanding that I may be on this pill lifelong, but it is not something to disable me or to discourage me. It is to encourage me that by taking this one pill a day, I'm able to prevent myself from having a stroke, to prevent myself from having a heart attack, to prevent myself from being on chronic dialysis. So it is a good thing in that sense, that if it's been identified, we are able to treat it and manage it, and you're able to continue with the normal quality of life. Yeah.
Thank you, Dr. Kunga. And you mentioned that depending on your on the category, either primary or secondary, I think this determines the kind of treatment modalities available for the patient. There's a question from Mercy in Mombasa, who says, I have a friend who underwent liposuction, and she was also hypertensive. So I seek to know, is it one of the available options to treat high blood pressure? Is it just a cosmetic part of it, or it can be considered part of, because reducing the obesity, the fats, can it be therapeutic for a patient who is hypertensive?
I'm glad that question has come, because as we said earlier, there's a lot of focus on obesity the world over now. Now, one of the treatment options we offer in hypertension-related obesity is, now, liposuction is usually limited to a particular area of your body where you think you have a lot of abdominal fat, so the plastic surgeon goes and just removes it from there, probably puts it somewhere else if you're going through, some enhancement procedures, or tosses away the fat that has been removed. It does not treat your obesity. It is not, for example, like other procedures, maybe, a gastric balloon or, gastric sleeve and other procedures that can be done to deal with, the amount of food you take and consequently lead to weight loss. Liposuction does not offer that benefit. It is instantaneous in a sense because it will only deal with the particular portion that you're removing that fat from. So to answer that question, no, it will not deal with the hypertension, and neither will it deal with your obesity. It will deal with your appearance aesthetically.
Okay.
Yes. So if you want to treat obesity, then again, see your physician, get the right kind of advice. Even in terms of those surgical procedures, we will be able to advise you on which one is safest for you. Yeah.
And thank you, Dr. Kunga. I think, Mercy, you've got your the response to your question. We have spoken at length about exercises and the importance of consulting an expert to guide you through on what exactly to do and how to do it right. Are you in position to share some of these, the kind of exercises that could be more beneficial for somebody who has been diagnosed by hypertension?
Yeah. So We emphasize on both aerobics and strength training. When we say aerobic, we don't necessarily mean the jumping up and down Zumba type or dance type kind of exercise. Aerobics, even walking is an aerobic exercise. Brisk walks on the treadmill or on the road, going up and down the stairs, that is aerobic exercise. Anything that you will do in motion to sustain your heart rate slightly above the normal. 10 to 20 millimeters of mercury above the normal, sustained for 15 to 30 minutes. That is good enough as an aerobic exercise. So you can imagine somebody who you've diagnosed with obesity and hypertension, and you're telling them, I want you to be running 5 kilometers a day. You're going to wear out their joints, and they're going to end up with arthritis. So you'll pour salt on the injury they already have. So things like walking, good enough. Going up and down the steps is good enough. Just staying in a state of activity, all those qualify as aerobic exercises. Strength training, lifting weights, sometimes even using your own body weight to do the squats, to do, even things that don't necessarily compromise your joint. Physical trainers advise on things like using the bands. Instead of weights, you can use the tension bands to be able to exercise various muscles in your body in a way that will not affect your joints, will not put you at risk of, those acute complications I've told you sometimes people develop in the gym. So you're able to do it safely. And that's why we emphasize, before you start on those exercises, talk to your physician. Sometimes even the physiotherapist in the hospital can be able to advise you on the safest way to go about it.
Thank you. Now we have another question from Alphonse, who is watching from Nanyuki. He says, why do we have so many people nowadays grappling with diseases compared to the ancient times? There are a lot of people in Mashinani with the issues of lifestyle diseases, which is not that much, but they still have these issues. What could be the precursor?
There is clear data from studies that have been done to indeed prove that point, and it is true. Nowadays, the fact that you live in a rural area vis-a-vis an urban area does not guarantee that you'll be healthier than the other. We see more cancers, for example, specific types of cancers, more in the rural than even in the urban areas. It's all to do with various, like we said, the human environment. Sometimes, because that question was broad, I don't think he was referring to just hypertension, but in general,
yes.
We seem to have a lot of chronic illnesses in terms of how we are growing our food. In the ancient times, they would mostly use the natural fertilizer, the mbolea, that one from animals.
The organic.
Now we are using a lot of these chemicals to grow the food. Once we get the food from the farms, are they being washed and, sort of removed of those chemicals that have been used to grow them? So you can think you're eating a healthy fruit, but the coating of that fruit is all chemical. Of course, it's going to end up with certain medical consequences. Inactivity. Before, people of the ancient past, there was no traffic those days. People would walk from here to the next place. There were no these big trucks to farm. Now people would have big farms, but they would walk around the farm planting and doing this. So they were more active. Now most of the large-scale farming is done using all this technology. So those are some of the differences. Even if you've not done a study, you can just see that there's been a difference in terms of how people lived in the past and how we are living now. So even emphasis on, when we say healthy food, even when you're in an urban place, where are you buying it? We've seen all these things in exposés on TV of where these things are grown, and the water could be dirty and contaminated. Those chemicals, as we've said, are processed. Sometimes you're eating fish that has grown within days. Sometimes reference to what kind of food these animals have been fed. Are they heavy on steroids, which will predispose you to certain cancers and even things like hypertension and diabetes? So even in looking at what you're eating, it's good to know where are you getting it from, and even go the extra mile to find out how has it been grown up to the point that it's on my plate. It may not always be easy, because sometimes you're in a situation where you just have to buy food from what is nearest, but whenever you can, it's always good to question and go for what may be healthiest for you.
Great, thank you. Alphonse, I think you have, it's of course not easy, as Dr. Kunga notes, but it's worth the effort, because they say health is your greatest wealth. And with technology, as she mentions, it's considered as a double-edged sword. There are positives and the negatives. Of course, we have a lot of emissions nowadays, and where we've seen even in the capital, Nairobi, there has been a concern on how the vegetables are grown with some allegations of, the waste emissions that really contaminate where the gardens were, or the farms, or the vegetable farms. So it's always good also to note that, but we hope we are able to make a stride on this. On hypertension still, there was a question, this was just a side conversation, on the expectant mothers. We get to a point where a mother has to be induced when they are hypertensive to even give birth to a child prematurely. How gross is hypertension or prevalent among expectant mothers?
It's not uncommon to have hypertension in the pregnant mothers, and pregnancy on its own, as natural a condition as it is, in the medical world, sometimes we jokingly refer to it as a disease on its own because of the physiological changes that it puts the body through. And on its own, it is a chronic inflammatory state for those 9 months. And remember, I've mentioned that when you're in a chronic inflammatory state, it predisposes you to things like hypertension. Not every pregnant mother will develop it, but there are those who will. We take it very seriously in pregnancy. And remember also, there are those who are hypertensive and will end up pregnant. So it's both ways. You may develop it in pregnancy, or you could be hypertensive on medication and you want to conceive.
Yes.
So both of those profiles of patients, we handle them jointly as physicians and the obstetrician gynecologist. So we have to decide when you want to conceive, talk to your physician. We change you to a medication that will be safe for the baby. And if we diagnose it in pregnancy, then we are able to shepherd you through the process so that you deliver safely. One of which it is early induction. If it gets to a state of excess pressures that we call pre-eclampsia or eclampsia, we are able to manage it, because there now it becomes life-threatening to both you and the baby.
Thank you very much. And our time is almost up, but before we close the conversation, there are some myths and misconceptions I think we would like to address. You already addressed the high blood pressure, that being there was that belief that it was a disease for the older people. Things have changed so far, and then that if you do not have any symptoms, your blood pressure must be normal. I think that's not the case from what you mentioned during our introductory part of this. And then there's this, I'm fit and healthy, so I don't need to worry about high blood pressure. And then we have, I only need to take my blood pressure medication when I feel like unwell, so I have to be having other symptoms that point to a specific illness for me to get to the hospital to check my blood pressure. Or reducing salt is the only way to lower blood pressure. All these are some of the myths. So how best do we debunk this, and how do we go about it to make sure that it's we sensitize people to live a healthy life?
Yeah. I find that funny. I'm fit and I feel healthy, so I cannot be having blood pressure. No, we've seen a lot of physically fit clients coming in with cardiac arrest and strokes. Again, the only sure way of knowing what your blood pressure is to have it checked. It is a silent killer because by and large it is symptomless. So have it checked. No matter how you feel, the only mirror into your body is using those medical devices to check it, and then we are able to tell you that it is normal or not normal. But that is not to discourage people from maintaining healthy lifestyle. Please do continue, but get your wellness check so that you're sure 100%. The other point you've mentioned is that many people feel that I am feeling better now, my pressure was high, I've checked it today, it's normal, I can stop my medication. And I think I have emphasize that a lot because it is something that we come across very, very often. Now, when you're taking your blood pressure medication, we expect your pressure to go back to normal. Really, it is why we are putting you on the treatment.
Yes.
So if I start you on treatment today and tomorrow you check your pressure and it is within normal, it means the medication is working and you should continue to take it. The minute you stop taking it, the pressure will go back high. It is normal because you are on treatment. So you should continue with that treatment unless for any medical reason you come and we tell you to stop. So we don't start hypertension treatment with an end in mind. No, and when you check and it's normal, that's a good thing. It means the medication is working. Keep taking it. Don't stop.
Thank you. And of course, they also have a tendency of discontinuing medication. There's so many people. The body might also develop immunity against these antidotes that have been prescribed. I know we are running short of time, but Joseph says, kindly advise before closing the conversation, as a specialist, what are the best cooking oils to use?
That's an interesting question. That question has so many answers. Usually we generally say plant-based oils are good, but even amongst the plant-based oils, there is a way the processing is done that will be able to tell you whether or not this oil is the best. Now, the very best of them in terms of saturated fats being very little and in terms of health effects on the body, unfortunately, in our markets, they tend to be very expensive. So you'll tell a client to be, on things like almond oil, canola oil, all those things are out of reach for a majority of the population. So within what is affordable to you, which one would be the best option? That is what I would encourage. And that's why I'm saying even the Kenya Bureau of Standards has done very well by telling people, write what is contained in your fat. So I am challenging everyone who's watching that the next time you go to the supermarket to pick that bottle of oil, turn it at the back. You will see the total number of kilocalories written, the amount of saturated fats is written there, energy levels, protein, everything it offers is there. Compare bottle by bottle, and within what is affordable to you, see which one is the healthiest option as far as low calorie count and low levels of saturated fat.
Great. Joseph from Ruiru and others who are watching, that is a challenge for you, for your own safety and of course healthy living. And as your parting shot in a few seconds, give us what you would consider, what the person who is watching can do, what they can uphold in their normal living in order to keep hypertension at bay.
Thank you for that. So stay active, number one. That is something that will not cost you any money. Stay as active as you can. Walk whenever you can. Move around. Keep your body in a state of a raised heart rate that is safe for your body. That will go a long, long way in preventing a lot of these lifestyle illnesses caused by a sedentary or inactive lifestyle. Number two, in terms of your diet, if you start living as if you're sick, it is unlikely that you will get sick. So if you're not yet hypertensive, then the encouragement is that you start living healthy. Low salt, low fat, low processed. We've already said about even the cooking oils that you use. Start living as if you have it, okay? So that then you stay healthy. That way you're able to prevent it. And also if you have unsurety of whether or not you're hypertensive, then the best way is to have it checked. If you can buy a blood pressure machine for your household, with all these pandemics coming up, COVID-19, now we are in the monkeypox era, most of these gadgets are very affordable. If you can purchase one for your household, and every once a week, once in 2 weeks, take your blood pressure, know what it is. If you don't have it in the house, pass by a pharmacy, by a clinic, get it checked so that you know what is going on in your body. And if you're in a position to have a wellness check done in a medical facility at least once a year, then the best thing is that you schedule yourselves to have that done so that you know exactly what you have. When we diagnose it early, we are able to prevent a lot of complications.
Absolutely. Early diagnosis, that applies for all other health conditions. Thank you very much, Dr. Olive Akunga, for sharing your expertise on hypertension with us. We hope to host you again in subsequent conversations.
My pleasure.
Great. All right. So Remember, high blood pressure, as has been shared, can be managed and prevented. And of course, with the risk knowledge and lifestyle choices that have been shared, if you suspect you might be at risk, don't wait. Just get your blood pressure checked. Do what Dr. Otunga has advised. Consult professionals. I know we like shortcuts. And of course, sometimes the tough economic times force us to opt for the easier and cheaper options. But make those vital lifestyle changes, continue to live a healthy life, and of course we will continue with the conversations at Mater Hospital in partnership with Capuchin Television. I've had the team working behind the scenes. As usual, I'm never alone to coordinate all these elements, making sure that we come to you live on our social media platforms as well as on TV concurrently. Requires more than 10 hands. So we had behind the scenes Eric Otieno, we had Mavaton Charles, Cyrus Njiru, Kevin Kitavi, Justus Okari, Father Vincent Shumila, and Dr. Otunga was here with her colleague Eric Mutea, and on the other side of our main offices, the head offices in Karen, we had Peter Mwangi. So we really appreciate your conversation and particularly your engagement towards this. So until next time, take care of your health. My name is Sasha Elizabeth, signing off from the Cardinal OTUNGA Plaza at the senior most ecclesial entity, that is the Holy Family Minor Basilica in Nairobi.
Hi, I'm Aisha Wankio, and Mater is my #1 hospital. My encounter at Mater Hospital was actually so far my best, because you see, when you enter the doctor's room, the doctor is just ready to listen. The doctor is warm. The doctor is kind.
We have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
And I would wish young people could come here too, so that they could feel how I felt. That's why I keep coming to Mater over and over and over. Their services, top notch.
Mater Misericordia Hospital. You matter to us.